Hey guys, my name is Mercy. Welcome to my channel. I'm super excited for you to be here, and in this video I'm going to talk about my emergency medicine rotation. So if you're interested, stick around and we'll talk about how my first rotation of residency went. And don't forget to hit that subscribe button and the like button if you did enjoy this video, and definitely hit that bell button so that every time I post you are notified. So if you guys watch my videos, whether my vlogs or you keep up with me on my posts on my Instagram or my stories, you guys know I was contemplating between internal medicine, family medicine, and emergency medicine. Actually, endocrinology as well. That's if I did internal medicine. But I quickly ruled out emergency medicine because of the burnout rate. That really scared me, actually. Not only that, but also the fact that I just stabilized patients and then they would go either admit to the floors or go into the ICU or, get surgery. That was the extent of care for those patients. I really liked the continuity of care as well. Like, I didn't want to just do emergency medicine where I just stabilize the patient and then they went somewhere else for the rest of their care. Both with EM and IM, you didn't really work on preventative care. It was more so deal with what was brought in, deal with that acute situation, and then stabilize them, and then, hopefully they continue with their primary care to avoid any exacerbation. So, and I wanted to be part of the preventative care, so that's why I chose family medicine. The reason why I say this is every single time that I went into my shift, I was like, could I pick the wrong specialty? Literally every single time. I love emergency medicine. I definitely would text whether it was my family members or it was my friends. I'm like, did I choose the wrong specialty? Now, I know the answer. I definitely chose the right specialty because I think over time I would definitely feel like there was something missing. I think it also has to do with the attendings that were involved. I literally thought all the attendings were absolutely phenomenal. They did a great job teaching. They were really helpful. So basically, you would go to see the patient and you gather all the history, the physical exam, and then you'd go present it to the attending. With the attending, you're going to make all the orders. You're going to discuss the orders and what you're thinking this patient has and what's going on and whatnot, and then they'll either agree with you in regards to your plan, or they'll add on to it, or they'll say, well, that test is really not necessary because blah blah blah, and they'll explain to you what their thought process is. But before they give theirs, they want to know yours. In the very beginning, because it's also my first rotation, I didn't know how to order accordingly. So especially because different systems are different as well. It's also learning and training in Epic as you're doing your residency, or whatever system you have. The first one I worked with, she showed me, or she was right by me as I put in the orders, and she would help me do the orders. And then as the days progressed, most of the attendings would just say, okay, go ahead and order them, and then I'd go order that, whatever it was. And if there was any mistakes, what they do is they look at all the orders, because they can obviously see all the orders that you've made, and I can see all the orders that they've made. And they look through. A few times I incorrectly ordered the wrong one, because there's variety of types that you can order. So they just would correct it, and they would let me know hey, you actually did the wrong one. You should do this one. Sorry, my lighting's a little all over the place, but it's so nasty out, so I feel like I come out bright and then dark. Anyway, so they provide that guidance. Once you make the orders, then you obviously wait for the orders to come in to then decide what you want to do next. Does this patient need to be admitted? Does this patient need to go follow up with their PCP and they're okay as of right now? Does this patient need fluids? Does the patient need antibiotics to get started? There are cases where we involve crisis, which is basically someone that's suicidal, someone that has more mental issues that we can't really help, and they need assistance that we can't provide. And we, with the Epic system, we assign ourselves to a patient. So you'll have so many beds. So you see all the beds that are filled, and then you'll see people in the triage, people in the waiting room. Once you see that they've been assigned to a room, that's when I mean, you can do it earlier on, even when they're in triage if you want, but you can assign to that patient and then go see the patient. And then you write your notes on that patient. So you have your set of notes, and the attending is going to have their set of notes. notes. So we have to accomplish 200 hours of emergency medicine and in 1 month. That can be a lot and it can be exhausting, but it's definitely doable. So what I did was I worked 4 days a week of 12 shifts, and that gave me 192 hours, and then I worked an extra 8 hours on a weekend. Was it a Saturday? Yeah, I worked it on a Saturday, and that totaled me up to my 200 hours. Once like they establish that you kind of know what you're doing, they don't baby you, they don't hold your hand, especially as a resident. They don't. They'll like give you guidance when you ask, and that's a great thing because that's how you learn by doing, not in the cost of the patient at all, by no means, but I'm saying like they're not going to just sit there and be like, oh, so did you see a patient? Like, you know what I mean? You have to just do it on your own. Whenever you go in, you assign yourself a patient. Once you have assigned a patient to yourself, then you go and present it to the attending, and there's like a doc box. So I just go in and I'm like, does anyone want a patient? And it just becomes kind of like one of those, like, I don't know, like an annoyance. And I just felt like I was annoying to them. They would just be like, sure. And most of them would be like, yeah, I'll take it. It just made it seem like they just were like, whatever. But so that was the only part where, I mean, it's not that I didn't like it. It was just like, I have to go in and walk over and be like, can I present a patient? Most days were actually really busy, so I only seldomly had like a few slow days. It was either a good steady or it was super busy. I have so many great stories that I'll never forget with like patients. Obviously the patients really makes the whole experience an amazing experience. So during EM there were times where you just like kind of sitting around if it was like a slow day. So what I would do is take my laptop and study for step 3. And then the other thing that I also did was to learn through each patient. So as I was going through each patient, I wrote out like the scenario, and then I wrote out like what we ordered and why, if it needed the why. Especially with brand names I'm not really good with, so I would like write down like, okay, these are brand names, this is the brand name for this generic medication. So that was something that I also did as I was going through, because that was my way of studying and my way of learning as a resident, because really this is the year that you really learn how to be a doctor. Unfortunately, like during medical school you're just learning diseases and diagnosis. You're not being trained how to be a doctor, what dosages to order. Of course, the best environment to be learning all of that is having a great team, and so I'm very fortunate that every single attending that I worked with was really helpful. The one, I remember my second day, she literally was, because I had to admit a patient. I've never admitted a patient from the ED. She was just like, okay, so we're gonna admit this patient, you're gonna do this, this, and this, and kind of explained it real quick and then left. And I had to do it all, like, I was like, wait, what? But I figured it out. And I think sometimes when you need to get pushed out there to just do, like, you'll figure out how to do. It's like just kind of, you know, throwing a baby in the water and they just learn how to swim. And that was basically me. A few times that's what happened, and I loved it because I feel like that's how I learned the most. It is really scary, but I really appreciated that, and I think I did a decent job, so it's okay. I mean, the times, like I said, like if I were to have made a mistake, or if I said something incorrectly in terms of like the orders, I would get an explanation for why that's wrong and why this way is the right way. So in terms of notes, so yes, you do write your own notes. I kind of talked about that. So you do a history, an HPI, a review of systems, a physical exam, and then there's something called MDM. So that's basically explaining like why you did the things you did while they came in. So this is kind of to also cover you, so you have to like explain yourself why you did certain tests. But that's it. I mean, everyone in the emergency medicine, they were so sweet. Their nurses are really incredible. So emergency medicine was my first rotation, and I had an excellent time. Like I said, to the point where I was questioning whether I chose the right specialty, which I did. But I really enjoyed myself while I was there. Will I do electives in emergency medicine? Yes. Will I try to pursue a fellowship in emergency medicine? Possibly. We'll see. Maybe I might work at an urgent care for some time. I don't know yet. So I'll figure that out in the next 2 years. But yeah, so I had a really good time. So I hope that this video was somehow informative, and I wish you guys the best of luck in whatever you're doing, wherever you stand, whether you're a high school student, a pre-med student, a medical student, or whether you're in residency. Thank you guys once again for watching, and I'll see you guys in the next video. Bye guys.